Good morning, everyone. Welcome. It is Monday, March 9th, 2026, and we are meeting as the Urban County Policy Board this morning and have a full agenda, including funding recommendations for our 2026 funding. So with that, we'll go ahead and move on to item number 1, introductions. I'm Councilor Young, Clark County Council, serve as chair of the Urban County Policy Board, and we'll start in the room.
Good morning, Michael Torres, Program Manager with Clark County Community Services.
Good morning, Rebecca Royce, staff to the Urban County Policy Board, Community Services.
Hello, Noreen Ibrahim, Program Assistant for Clark County Community Services.
And online?
Online, we'll just go through our list. Joe Walsh.
Joe Walsh, City of Washougal. Good morning.
Stephanie Fields.
Stephanie Fields, Town of Yakult. Good morning.
Councilor Ferrer.
Councilor Ferrer, City of Battleground.
Mayor Cole.
Yeah, good morning, everybody. Matt Cole, Mayor of Ridgefield. Good to see you all.
Lauren Hollenbach with the City of Camas is also available. She's having technical issues and not able to unmute herself. We also have plenty of guests at our meeting today from the City of Vancouver and our applicants joining us today. Would you like us to go through that list?
Sure, why not?
All right. We have a Chris.
Hello, I'll be right back.
All right, thank you. Darius Vargan.
Good morning, I'm Darius Vargan, a citizen of this county.
Drew Brown.
Hello, Drew Brown. I'm the Senior Director of Housing for Sheriff Vancouver.
Jay Stanek. I can see that you unmuted, but we did not hear you, but we will assume that you are here. We'll move on to Jacob Polowitz.
Good morning, Jacob Polowitz, Development Consultant for Foundation for the Challenge.
Johanna Pavasteran. Melanie Fowler.
So, good morning, this is Melanie Ford from Upwards. Thank you.
Michelle Schuster.
Hello, Michelle Schuster, Clark County Director of Internal Services.
Tasha Slater.
Hi, good morning. Tasha Slater, the City of Vancouver. I'm a senior housing planner, and I oversee the CDBG and home funds at the city.
And we have one more visitor in the room. Would you like to introduce yourself? Press the button on the mic. There you go. Just
Here.
Introduction, your name?
Matt Brock, Share Alhaas Program Director.
Thank you.
Great. Thank you, everybody, for being here. Let's go ahead and move forward to item number 2, which would be public comment. Is there anybody in the room or anybody online that would like to make a public comment?
Yeah, I can go.
Sure, go ahead.
Hey, everyone. My name is Chris. I'm a project manager. I've managed 2 of the projects here, really close to CMAR, so I've had an opportunity to see them both working, work by there often, so I do have a comment here. So my concern is not with the mission of CMAR WIC, which I support. They provide real services to families in needs, and that should be acknowledged plainly in the outset. My concern is whether this particular building is the right place for those services. whether the public is being asked to accept a weak use of the high visibility downtown property simply because the mission itself is sympathetic. Those are two different questions. A good mission does not automatically make every property decision a good one. From the perspective of those who work right next door, this building appears to be underutilized. Whatever may be said publicly about the number of appointments or clients served, the simple reality is that we do not see a lot of consistent traffic in and out of the building on an ordinary day. And I think that matters. It's not speculation from a distance, it's observation made over time. Like I said, I worked right there. You know, and even if appointments are happening inside, the practical impression created by the site is still one of limited activity rather than any, you know, meaningful public presence. Also, the condition of the building kind of compounds the problem. It hasn't presented itself as well maintained, active, or cared for. That strengthens kind of the Main Street downtown area. Instead, it looks neglected, has visible trash and graffiti. It doesn't kind of reflect the importance of its prominent location in the downtown core. And so, you know, then there's the broader economic point, I think, that shouldn't be ignored. You know, even when the building is being used for client appointments, it doesn't appear to contribute a lot to the economic ecosystem of Main Street. You know, we have coffee shops and active retail space there, restaurant, market use, other public-facing tenants there, and it doesn't really seem to draw a lot to Main Street. And so that's kind of where I'm at is, does it lead to CMAR's work? Is, while it's important, it sounds like a lot of it can be handled through video appointments or remote. So my kind of argument would be for keeping those operations in the exact building. Doesn't really make sense, not when we have they have other options. And let me see here. I had a couple notes. There's also a question of public accountability, in my opinion, after looking at it, even after the building is conveyed and subsidized with public money. The only real condition is that it used for the stated 5 years, after which any organization could, you know, retain the asset, sell it, and keep the proceeds. And I think that deserves some public scrutiny there. Taxpayers have a right to ask whether public resources are being used.
Thank you. Your time is up. Is there anyone else that would like to do public
all
comment
of this kind
today?
of comes together. Oh, okay. My
Thank
time's
you.
up.
Thank you.
Thank you, Chris.
Is there anyone else that would like to make a public comment?
Sure, I'll make one.
Go ahead.
Okay. Good morning. My name is Darius Virgan, and this morning I'm commenting on the county-owned building at 701 East Main Street, a location that I believe is ready for a new chapter. This building is underutilized, undermaintained. As neighbors and members of the community, we see the reality daily. There are very few cars and very little activity. The building itself has unfortunately become an eyesore on Main Street, and it's failing to contribute to the economic ecosystem of our downtown. Given the significant portion of online appointments that CMAR and WIC services have shifted to, I think that their operations could be more effectively and efficiently accommodated at other locations or in a more suitable facility. I think this property should be unlocked to serve its potential as a true community asset. And I do have a specific question similarly to what Chris touched on. I have a question regarding the potential sale of the building. I understand that you may not be able to respond to my question directly today, but I'd like to pose it for your consideration. If the building is sold to CMAR for $1, is it true that they would only be required to use it for purposes consistent with their grant for 5 years, and after that they could sell the property and keep the full proceeds? If that's the case, it does seem like a significant loophole that involves taxpayer dollars and a county asset. I think there's a better path forward, one that would turn this site into a vibrant space that brings together the people of Main Street and creates a landmark for the entire city of Battleground that they can enjoy and be proud of. Thank you.
Thank you. Any other comments? Okay. All right. Thank you. Let's go ahead and move on to item number 3, which should be approval of both the January 12th and February 9th, 2026 meeting minutes.
Looks like we do have maybe one more public comment.
Oh,
Sorry. Melanie?
go ahead, Melanie.
Yes, sorry. This is Melanie with Upward. So I wasn't sure if, as a CDBG applicant, now was an appropriate time to submit public comment.
Was it public or?
If there's a meeting item on the
Is it
agenda.
just a general public comment, or is it related directly to the application process?
I just wanted to, make it clear I'm here if there's any questions that arise, and then also just highlight that we actually just published an impact report for the Boost program, and I just wanted to be able to share that what the report basically illustrates from the last couple of years is that our projected outcomes are very conservative, and I'm pleased to share that in nearly 30 cities and counties we've run the program, we've exceeded those projected outcomes. So just to keep that in mind, we like to underpromise and overdeliver, and I'm here for any questions.
Okay, great. Thank you.
Thank you.
Okay, so meeting minutes of January 12th and February 9th. Any changes recommended from anybody on the board? If not, I would entertain a motion.
So moved by Councilor Frere.
Thank you. And is there a second?
I'll second that, Chair, by Cole and Richfield.
Great, thank you. So it's been moved and seconded. Are all those in favor say aye?
Aye.
Aye.
And any opposed? Great, motion passes. Thank you. Moving on to item number 4, Rebecca, giving us an update on the October to December 2025 quarterly review report.
Thank you. Actually, we're going to have Noreen go ahead and give this update to the board.
Good morning, everybody. So we're going to start off with the public facilities and neighborhood infrastructure projects. Not much change here. We have 3 projects that are moving forward currently. We have Ridgefield G Creek, Battleground Northeast 1st Street, and VHA Bertha's Place. And then Washougal Hamlet Park is now fully complete. We can go to the next slide, Rebecca. And then in our asset and economic development, Hispanic Metro Chamber is going to be extending their contract into 2025, their program year 2024 contract, which will extend for a few months, and they will be bridging any financial gaps with their own funding. Greater Vancouver Chamber's outcomes were significantly lower than proposed. And Fourth Plane Forward, it has started their 2025 contract. Proud Ground has multiple properties that are about to close, and they're set to use their program year 2023 and 2024 contracts within the next few months. And we're still on a pause with the Evergreen Habitat for Humanity contract because they have some insurance coverage that they require that they haven't provided to the county yet. Next slide. And in our affordable housing and homelessness, the Weaver Creek project is moving along and all documents have been recorded as of last week. Most of the progress for this project this quarter was actually drafting all of those legal documents and contracts. Columbia nonprofit River and Main is working on securing more funding, including applying for additional home funds in this round of funding. For TIPA programs, Janus completed their programs and they served fewer households than proposed. Lifeline Connections finished their program and did not request any additional funds in the 2026 RFA. Share was close to meeting their outcomes, but they underspent in their home funds, and those funds will be allocated into today's awards. YWCA asked for an extension through March to complete their program. They did not request any additional funds as well, and Janice and Share's program year 2025 programs are underway. And that's it. If anyone has any questions, we're happy to answer.
Any questions? Okay, thank you, Noreen. All right, we will go ahead then and move forward to the most exciting event of the day, which is our 2026 CDBG and home funding recommendations.
The HUD funding update.
And, oh, did I skip
So
something?
we'll start with our
Oh.
HUD funding. So this
One more important
one
just
thing before
the
we
fun
start
stuff.
making some
Okay.
decisions.
Item 5, HUD funding updates. Thank you
Yes.
for catching that.
Thank you. So this is just an overview of how much funding we believe that we are going to have for this request for application funding round. We're going to start with our home funding dollars. The total projected amount available is basically the same as last year's, only $1,000 difference from our 2025 applications. The Transportation, Housing, and Urban Development Bill at the federal level was signed by President Trump on February 3rd, 2026. HUD then has 60 days to notify jurisdictions of their allocation amounts. So we have not actually received our specific entitlement amount yet. We should have that information by May 4th. Because the Congress passed a budget with the same amounts as program year 2025 for both home and CDBG, we do have a fairly good estimate of what we're going to have available. We do anticipate that the total amount will be off by, maybe a few $1,000s, but no significant changes from what is being proposed. The amount provided is our best guess and should be pretty close to that actual allocation. In addition to the estimated entitlement amount, we have a good amount of program income due to a large loan repayment this last year. So we are estimating around $530,000 in entitlement funds for program year 2026 for the home funding. Our reprogrammed and program income is just shy of $950,000. With that, we have 10% for administrative dollars that comes out of the entitlement amount. So roughly $53,000 will be held for administration of the program. And then as a reminder, the home program requires that we set aside 15% as a CHODO set aside, and that's our Community Housing Development Organization funds. Those go to very specific organizations. They have to have a specific board structure to be able to receive those funds. We do not have a CHODO eligible applicant this year, so we will hold those funds until next year and see if we get an applicant next year to be able to allocate these funds. We also set aside approximately $7,000 for activity delivery costs. So those are the costs to actually put the programs or projects out and get them completed. And then we have a housing preservation program set aside of $250,000, and this is an estimate. Earlier last year, the board approved increasing the set aside for the housing preservation program to $400,000 starting with this funding round. And with that, we're also using a combination of CDBG and home funds to be more flexible in the amount of funds that we have available both to applicants, but also into the home housing preservation program. So we're estimating $250,000 available there. So when we take a look at the remaining funds available to go out into our application, we have just over $1 million to allocate to our applications that we have received. Based on board's recommendations, we allocate 60% of those funds to our construction projects and 40% to tenant-based rental assistance. Are there any questions about the home funding before I move on to the CDBG funding? All right, not hearing any, we'll move to CDBG. So again, same situation, the entitlement amount is an estimate, but we do feel that it's pretty close to the actual amount that we will receive of about $1.6 million. In this round of funding, similar to last year, there was a lot less program income collected. A typical year is anywhere between $500,000 and $600,000. The last couple of years, it's been closer or under $150,000. This year, we have just over $100,000 to put into reallocations. The program for CDBG allows for 15% to administrative funds, so those are being held back. We also include $30,000 in contingency funds, and this is for if a project needs just a slight amount of increase, construction costs go up, something like that, we can have just a slight amount that is held back. Anything that's not used is reallocated into that reprogrammed funding. So anything that was from last year is now in that $100,000 of reprogrammed funds. We also have $10,500 set aside for project implementation for staff time directly related to the projects that get awarded funding. We have our TBRA case management set aside. This is an estimate. It can change based on what the board's final recommendation for funding in the tenant-based rental assistance program is. All TBRA programs get 30% of their home award in CDBG funds to make sure that they can carry out the case management services for the rental subsidies that are provided through the home program. And we are estimating just shy of $130,000 needed this year. And then to make that full $400,000 for our housing preservation program, we're setting aside $150,000 in our CDBG funds. This leaves us just over $1 million to allocate to applications this year. With that breakdown, we have our public services. That's 15% of our entitled amount, which we estimated to be $225,000. That's what we have available in the request for application. And then the remaining balance is split 60% to our public facility and neighborhood improvement program projects, and then 40% to asset and economic development. This year, we have kind of a special situation where because we are trying to meet our timeliness goals, we have the board approved not having an RFA for public facilities and neighborhood improvements. We took previous funds from the Battleground North Parkway project. We had received 2024 funding. We took those funds, put it into our housing preservation program because we know that program can spend money quickly to help us work towards our timeliness that's happening in May. And then with that, we promised we would give them the funding back with 2026 funds. So that project will move forward. That just has newer funds going into it. So here you'll see that it's not an actual 60% split to public facility and neighborhood improvements. It's just that $300,000 that is needed for the Battleground project, which gives a balance of $530,000 going into our asset and economic development category. So that is the funding overview of what we have available before we go into the actual allocations and recommendations in each of the categories. Are there any questions?
Rebecca, I do have a question. So the TBRA case management, who does that work and how does that work?
I'm not clear on the question.
So I think you're asking who's actually doing the case management for TBRA, and that would be the service provider. So it's the same service provider that is using the home funds for rent. Home does not allow funds to be used for that case management and supportive services. So the CDBG funds are used for that.
Okay, I think I remember that. Oh, I was off. I had my mic off. I just said thank you for that information. We have heard that in the past. It rung a bell when you said that.
All right. So with that, we'll go ahead and move into our funding recommendations. This first slide is just kind of an overview to remind the board of the process. The applications could receive up to 100 points each through a combination of subjectively and objectively scored responses. The Urban County Policy Board members reviewed all of the applications and submitted their scores to the subjectively scored questions through Neighborly, through the application software. And then staff provided the scores for the objectively scored questions, which are specifically outlined in the funding guide of how they can get those points in the few questions that are available. Then that combined average is used to rank the applications in each category. The CDBG and home funds have very specific allowable activities and cannot be easily moved between categories. There's only a couple of activities we can do that could be funded by either CDBG or home. Otherwise, it's either CDBG or home that has to fund those activities. Staff created the recommendations for the board's consideration. It starts by funding the highest scoring applications in each category. And then we use the CDBG and home funds at their maximum flexibility to fund as many applications as possible. And then those are provided to start the recommendations that you're about to see are just are provided to start a conversation, and they're not intended to sway the board. But we just want to remind you that we have looked at how can we be the most effective in using our CDBG and home allocations. In addition, staff looked at the scores across all of the applications, focusing on those with the highest scores as scored by the Urban County Policy Board. And if you're ready, we can start looking at, Michael, did you have a question, comment?
Just as an emphasis, even though we're saying here that staff created recommendations for board considerations, those recommendations solely reflect how the UCPB scored the applications. And then looking at the allowances, the regulatory allowances of the funding, how we could fund as many applications based on the scoring of the Urban County Policy Board. So that's the extent of the leeway in the staff recommendations. So I didn't even make it a recommendations in quote. This reflects what you chose.
Okay. So to start off, we really want to just make sure that you saw the funding set aside that we had talked about in the memos previously. So these first two tables show those activities that will be funded because of the decisions that board has already made. At the beginning of the RFA process, we had the board decision of going ahead and using the RFA funds, previous CDBG funds allocated to Battleground to get the spending going. So that's why you see the City of Battleground here for their North Parkway Avenue project at $300,000. And then we have the Housing Preservation Program that receives their set aside each year. And this year is now at $400,000. So we're going to start off with the affordable housing and homelessness projects, because the TBRA programs will affect how much CDBG funds are available in our future slides that we'll be looking at. And also there's just not enough funding to go to all of the applications. So with the 60-40 allocation method between construction and TBRA, we have $653,945 available for construction projects. However, we only had $600,000 in requests. So both of those projects, based on their scoring and the amount of funding availability, will get fully funded. So that will use $600,000 and leaves a balance of $53,945. For the TBRA program, the total available includes the $435,963 from the allocation method, plus the set aside funding for case management of $129,230. And then staff recommends including the balance of funds from the construction category, which that brings us to that $619,138 that's available in the TBRA category. This will fully fund both Janus Youth and Share as the top scored applications. Staff recommend that due to the low scores for the Salvation Army and Lutheran Community Services Northwest and limited remaining funds of only $33,000, that we move the balance of those funds to the Housing Preservation Program as part of that total $400,000. So not in addition, but it would be used as the part of the home funding available for that program. So those are our recommendations for the affordable housing and homelessness programs. The next category we're going to review is our public services category. Here we have $225,000 available. This is a new category this year. HUD caps the amount of funds for these services at 15% of our entitlement amount, and we cannot go over that allocation amount. The staff recommend fully funding the top two contracts, which are Battleground Healthcare for their dental services and Lutheran Community Services Northwest for their health services. Family Solutions and Lutheran Community Services Northwest childcare applications received the exact same score, and we looked at it out to the 8th digit to verify. With that, Splitting the amount between the two applications will be below our minimum $50,000 threshold for doing contracts. Because of this, staff recommend reallocating the balance of the $51,169 to our asset and economic development category, which had higher scoring applications that did not get funded if we do not move that $51,000 there. So as we were talking about, we looked at all of the scores across all of them as we were putting these recommendations together. So now as we look at the asset and economic development programs, the Urban County Policy Board opted to keep both home buyer and business assistance applications in one category. So they are competing against the same one pot. They're not separated out. The total amount available for the asset and economic development category includes the amount of CDBG funds available using that split, that 60-40 split by the Urban County Policy Board between public facility and neighborhood improvements and asset and economic development categories. It also includes the balance of funds from the public facility and neighborhood improvement category that would have gone into that category. It includes some home funds and the balance from the public services category. So that's how we get to that full $617,033 available. So as you can see, SELF, Upwards Care, and Proud Ground will be fully funded. Fourth Plane Forward will receive an award at 67% of their request. And then for contingency applications, staff recommend fully funding the Fourth Plane Forward program, followed by the Hispanic Metro Chamber, as they were the next highest scored CDBG eligible program. And staff would recommend holding the Evergreen Habitat for Humanity project as a home funded contingency project. These are being recommended because their total score is higher than the other unfunded projects in the other categories. The public services scores were 73.57, and the next highest TBRA program was 69.86. So that's the reason that Evergreen Habitat is being recommended, or Hispanic Metro and Evergreen Habitat. Evergreen Habitat is also being recommended as a contingency application, even though their score is lower than the Greater Vancouver Chamber, because home funds cannot be used for business assistance. So the Fourth Plane Forward fully funding and the Hispanic Metro would be our CDBG contingency projects if CDBG funds became available. And then if home funding became available, it would be the Evergreen Habitat, because that one is available. We can use home funds for that. So those are an overview of all of the funding sources. So staff are available to answer any of the questions and provide guidance on all of that, and we can go back and look at all of those categories for you. For the board, you can either approve the funding in each category and do a motion for each one, or you can take the whole package and just do one motion at the end if it's really what the board agrees on wanting to do. So with that, I will give it back to Chair and answer questions.
Great, thank you. Are there any questions from the board? I do, but I will defer to anyone else that has questions first. Okay. Rebecca,
I have one question.
Go ahead, Victoria.
Sorry. Can we go back to I do apologize. I'm trying to scramble to find all of my notes and the list of everything that we had voted on. What was the name of the I'm trying to look at specifically for the one that was over in Washougal for the senior housing for the 40 unit. Can we?
Yeah, so that would be the Columbia Nonprofit Housing, the River and Main new construction.
Okay, that's why I just wanted to make sure. Okay, thank you.
Yes.
Okay, I have a question on this slide.
Okay.
So please help me understand a little bit better. So that 53,945, where are you recommending that go to?
So that we included in that 619,000 in the TBRA program. So it stayed in the overall category, which is on the second table on the screen. So the Janus Youth and Share.
Oh, so it's going down there.
Exactly. So it's staying in the affordable housing and homelessness program
Okay, so
overall
we're
program.
essentially using 20,000 from that,
Because there's, correct.
and then there's still 33,000 remaining, which is going where?
So that we would recommend using in the housing preservation program as part of the home funds that would be allocated into that program as we kind of make that $400,000 total. It would be part of the home funds that go into that.
So that's slide.
Yes. So here we have $400,000 total, and that's a combination of CDBG and home funds. That 33,000 would be part of the home funds that are in there. So they're not getting any additional funds. It's just, and what that does is it frees up a little bit of the CDBG funds that we really need to fund the asset and economic development programs where we have a lot more applications in that category.
So the 33,000 is going into the homeowner rehab program,
As home funds, correct?
home funds, and then we're taking money out of the,
Housing preservation on the CDBG side, and we're moving that into asset and economic development.
And so that's absolutely correct. So what we're trying to do is within the allowability of home and CDBG, we are trying to fund as many proposals as possible based on your scoring. So by moving those $33,000 of home fund into rehab, which has primarily historically been funded with CDBG, but to do that 400,000, we're funding with both home and CDBG. We put those $33,000 of home funds into rehab. We can take those $33,000 from CDBG, as Rebecca was saying, and use it in the asset and economic development where there are more proposals, like, there are a lot of proposals and we don't have enough funding for them. So we can fund as much as possible.
okay, so theoretically it's going from here to here and then from here to here, but in actuality, what's happening is it's going from here to here.
Yes.
It's just, you have to do it this way.
And, staff are it's really important to staff that we be as transparent as possible so you can see exactly what the thought process was for how we got to the funding, which can be confusing, and we
Yes.
apologize.
Could we go back to the TBRA slide? No, not this one. Sorry. Is it the home? I think the home slide. It's the one that had the one that where the 53,000.
It's the first table on this slide.
Okay. There's one more, right? One other slide that I'm missing, not that one. Go back one. There you go. Okay. So this, I just had a thought. So and remind me that the Salvation Army and the Lutheran Community Services, are those both childcare or are they TBRA?
This is just TBRA. So that's all you're seeing here. So construction in that first
Okay.
table.
Where were the childcare ones at?
So that's in public services, cannot be funded by home.
Okay.
And that is the next slide.
And so this is where the childcare, so of those, okay, we had the dental, which was a battleground. And remind me what the Lutheran, there were multiple Lutherans. So there's childcare, but then what was the other ones?
So the health services is more of a health navigation. So it helps people navigate and apply for health services.
Okay. And
state and federal.
I thought the Family Solutions one was childcare as well.
No, the Family Solutions is their mental health services specifically for youth at Prairie, I think. I think it's specifically working with one of the local high schools. I think it's Prairie High School. And they might be doing others at their actual office, but it's more centered around providing behavioral health services to uninsured and underinsured youth.
Okay. So this is my thought as I'm looking at this, and I know that Family Solutions and Lutheran scored exactly the same score on this. And I know that there isn't enough to fund either one entirely, but I feel like childcare is a major necessity, especially given what's happening at the state level and at the federal level. And I'm wondering, do we have the ability to assign that balance of 51,000 to one of those two, or to the childcare program?
So yes, the board, I mean, this is unprecedented to have two score exactly the same. and the board can make that decision, we would need to pull that out of the asset and economic development category.
What would it do to that?
So looking at that, it would lower the amount available to about $130,000 for the Fourth Plane Forward program.
Okay, and is that something that they can scale down? And accept a partial, or is this kind of, we offer it at this point and they tell us whether they can work with that amount of funding?
Correct. Yes. So we would go based on what the board's decision is, and then we would notify. I don't believe we have anyone. Oh, actually, Johanna, are you available?
And the only thing I'll note, you can absolutely do that. And I will just highlight, not to sway you, but just to make you aware, the Fourth Plane Forward score is higher than the Lutheran Community Northwest child care score.
Understood. So I'm wondering if anybody else on the board has any thoughts on that. None.
They're a quiet bunch today.
Yes. Okay. Are there any other questions before we talk about how we want to move forward in terms of process on this? We are talkative this morning.
Nobody wants to make a real decision this morning. It's
Yeah.
Monday morning. It's early. That's true. I mean, this is all based on scoring, right? We took all of the scores from the Urban County Policy Board members, and that's how we came up with that. The numbers, the total scores that you see available specifically reflect what the Urban County Policy Board would like to see.
Sure.
And if I can add as well, I think you guys are showing care and concern for childcare in the asset and economic development category by funding Self and Upwards, which are childcare businesses.
Oh, that's true. There's Upwards and
And
Self.
And those are the top
Those were
scoring.
both childcare. I
So,
knew.
yeah, they're not providing direct service to childcare, but what they're doing is boosting the number of childcare providers, either
Okay,
that
which
don't
we
exist
believe
now
Yep.
or that they exist and are going to expand
Okay.
their services. So we
hard to
are
keep track of
influencing
all
the
these.
childcare. Thank
It
you,
is.
Doreen. That was a very good point.
Yeah. Okay.
I
That is a
do,
good point.
you know, again, like, I think that those are important things to remember. You do have the ability to make those decisions if you want to. This reflects what we can do with the funding based on your scoring.
Okay. And then what determines whether it goes on this list or the other one then when it's childcare?
It's the type of activity that's being done. So in the public services, it is direct service providing actual childcare services, and it's paying for operations of a childcare facility. In the asset and economic development is micro enterprise assistance, which is small business to low income businesses that have 5 or fewer employees, including the owner. And that is really technical assistance and could be like investment into, but it's the business side of it, not paying for the staff to
For the
provide
child
direct
care
service.
directly?
Yes.
Okay. All right. So there's support for childcare, but not any real direct.
Correct. Well, they're
Childcare
trying to
services.
create more childcare services in the community.
Okay. Victoria, it looks like you have your hand up.
Thank you, Chair. Are we supposed to be deciding on this today?
Yes, we are.
Okay, because my thought was, it would be nice to go over these numbers and review them and with a little bit of this information that, because they're great questions that you're asking, Chair, and just to have these little, like a little summary under each one of these tables, and to have more time to go over them myself and review them to have a final decision. But I guess if this is having to be done today, then never mind.
Yeah, unfortunately, we have a tight deadline that we have to meet for HUD. So I will, before you make a final decision, I'll just go over our next steps so you can kind of have an idea of what's happening here. Once your final applications are released from HUD, we will finalize the amounts in all of the award tables. Again, it should be just slight changes and basically would affect Fourth Plane Forward as a not fully funded application. Regardless if it's home or CDBG, we will make those adjustments in our housing preservation program to then make sure it just affects the Fourth Plane Forward application. We will do award notifications to the applicants, and then we have to draft the annual action plan. It has to go out for a 30-day public comment period. It'll be presented. We are on the schedule for County Council on May 5th, and then has to be submitted by May 15th. That is an absolute deadline to submit that to HUD. It has to be done 45 days before our program year starts. And so that's why there isn't really the flexibility to be able to say, oh, we'll come back to and revisit these scores. Staff will need that time to put the action plan together and get it out for comment. Also, just to finish the slide, we will be doing risk assessments for all of the agencies, environmental reviews for every activity, and then we'll be drafting contracts to get those done. And then we should get our grant agreement from HUD in the fall at some point.
And again, just in terms of process too, I would reiterate that staff has a recommendation, and then the Urban County Policy Board will also deliver a recommendation to the County Council. And ultimately, it is the County Council that makes that decision, although I don't know that they have ever, veered from what the board has recommended to them. So it would be unusual for that to take place. So with that, thank you for that information. Does anybody have a preference? Is there any other thought process that I think at this point, unless there's somebody that chimes in that they would like to take things one at a time, or is interested in talking a little bit more about what I had mentioned, or if they have ideas also for some changes that they might suggest. If there is none of that, then I would suggest that we take the entirety of the package and move towards direction on that. So if I don't hear anybody at this point, then that's what I will do, is just move forward with the entirety of the package.
Chair, I'll just affirm what you're saying too. I think that's the way we should go as well.
I'll
Okay.
second Ferrer.
Okay, so we have a motion and a second, but that was more to process-wise. Are we ready at this point to have a motion and a second on the package and the recommendation that we deliver to the County Council?
Sorry, Chair, I apologize. I didn't mean to inadvertently make a motion. I was just agreeing that I think that's the direction we should go. But if we need to make a motion, I'm happy to do it.
Okay,
Yeah.
so it's been moved, is that correct?
Yes.
Okay.
I'm not.
And then Victoria, did you want to second that?
Yes, Chair.
Okay, it's been moved and seconded at this point to accept the package as recommended from staff as it currently sits as a package. Any discussion?
Just a thank you to staff for the work you did to that. I know you're taking all of the inputs from every jurisdiction and put them together and kind of trying to make them sync. So we appreciate the work you did to that, and the package is great. So thanks again.
Great. I don't hear any other discussion. So all those in favor say aye.
Aye.
And any opposed? Motion passes. And I would like to take a moment to also echo staff's efforts as well as the Urban County Policy Board. This is a lot of applications and a lot of time to score all of these, and especially want to thank all of those that applied for the grant and that are doing the good work in our community. It's unfortunate we can't fund every one of you, but continue to be a part of this process and continue helping our community become a better place. So appreciate all the work you do.
Rebecca, this is unfair to you because we've gone through the slides and we've gone through the notes, but do you know off the top of your head how many new applicants we had this year?
I would say we had maybe 5 new applicants
That have not contracted with the county before.
that have not applied. We have, I think, 2 that have applied but not been funded before that will now be funded for the first time.
And we had over 20 applications in all.
Yes.
Thank you.
Okay, thank you for that work. Let's go ahead and move on in our agenda. Item number 7, so county-owned building discussion. Rebecca, I will let you introduce this and any speakers that might be available to communicate on this issue.
Fantastic. So you've seen these slides the last time. It's just kind of a little bit of an update, just a background on the discussion that the board has been having. So this is a continuation from discussions that started in October, carried into November and January. This is requesting the Urban County Policy Board to have a recommendation to provide to the Clark County Council on what to do with a county-owned building that was purchased with community development block grant funds. The county-owned building was purchased way back in 1993, which is the previous millennium. We have a current lease with CMAR since 2009, and they've been providing primarily WIC services, but some other services in that building. Based on CMAR's information, they serve over 900 clients each month, with over 600 of those being in person. The building itself is in need of significant renovations. Per a Ming report back in 2019, is about $1.7 million needed for that building to bring it up to code and just in good condition. The county applied for funds in 2025, and they received $200,000 of CDBG funds to start working on those renovations. The county also was applied for some congressionally directed spending for $1.7 million through the federal budget, but was not a recipient of those funds. So those are no longer in consideration on the county being able to fully renovate that building. There's 3 options that staff have put together for this discussion. The first is to sell the building to CMAR for $1, which would include a 5-year restricted use covenant, meaning they would have to use the building for services that are eligible under CDBG for 5 years. This would have no effect to the county's timeliness issues that we have been battling. No additional investments would be needed by the county for doing that. This CMAR would make the renovations needed to the building, as they've already mentioned that they would be working through. For CMAR to do those renovations, the cost is lower because primarily prevailing wage, but some other federal requirements that come along with our federal funds. And then they said they would be completing those renovations in phases using proceeds from providing more services at that location. The 5-year restricted use period would again require them to serve low-income households and be CDBG eligible services. Our second option is to sell that building at fair market value. This may impact the county's timeliness ratio if sold before May 2nd. At this point, we wouldn't make that timeline. However, it could impact our timeliness next year if we do the process within this year. We staff, and we'll see later in our meeting, we'll have a discussion on timeliness. We are optimistic that we'll make our, but I'm very nervous about it. With selling the building at fair market value, there would be no additional investments needed into the building itself. The county will incur costs to conduct an appraisal and to sell the property on the open market. And then CMAR would need to relocate their services to other locations. They had mentioned most likely their Hazeldale and possibly Vancouver locations. That relocation would require them to get approval from DSHS, the Department of Social and Health Services. And then the third option, which the board has mentioned many times is not really something you're interested in doing, is just no change in us maintaining the building as it is with the lease with CMAR at this time. So there were some additional discussions over the last few meetings. One, wanting to know the assessed value, which is approximately $467,000. If the county used the funds to directly purchase the building was a question that was had. This would, if we moved in this direction as this option, the funds available, that $467,000 would be insufficient to purchase another location in Battleground. And then we would just end up at kind of the same situation. We could adjust the lease for the tenant and make sure that they maintain the building better than what the current lease is on the current building. But again, we would not be able to charge them rent or anything else. That money comes back into the CDBG program and can't be used to maintain for maintenance purposes on the building. Another option that was discussed is conducting a targeted request for application for having a nonprofit building acquisition with using that whatever proceeds from the sale, roughly $467,000. Funds again would be unlikely to be sufficient to purchase another building, so other funds would have to be brought in to by the nonprofit to acquire another building. We also, by doing a targeted RFA, cannot guarantee that we would have any responses to such a targeted specific RFA. And we also would not be able to guarantee that CMAR would be awarded funding if we received multiple applications under that request for application. And then the City of Battle Ground has submitted a letter supporting option number 2, that to say the sale at fair market value due to the redevelopment that they're wanting to do in the area. And I'm not sure if we have staff from CMAR on the call. If you are from CMAR, can you please unmute yourself? I am not seeing anyone from CMAR. At our previous meeting, we had asked them to discuss more about their plans for renovating the building, what their relocation plan would be if we sold the building at fair market value, and then if they could research buildings that could use WIC services in Battle Ground, as one of the discussion points from the board is trying to keep the WIC services in Battle Ground. So I don't see anyone here. I can say from the previous discussions that they've had that are noted in the minutes, the plans for renovating the building, they would renovate the building, but it would be in phases. They would be able to do it at a much, not much, but a less costly price tag than if the county does it, because they're not a public agency. We would be required to do prevailing wage. We would be required to follow the Build America, Buy America Act, Section 3 requirements, Davis-Bacon, which is a prevailing wage requirement, along with other federal requirements, including environmental reviews and things like that. So there's a lot of things that would increase the cost of us doing the renovations as a public agency versus CMAR doing the renovations. They also have an in-house architect and design team, so they're not accruing extra costs to do the work to get the building ready for construction. They had mentioned in previous meetings that if the building is sold at fair market value, then they would likely not be looking to purchase another building within Battle Ground. They have existing buildings in Vancouver and in Hazeldale that they would most likely apply to DSHS and ask for approval to move the WIC services to one or both of those buildings. So the WIC services would not continue within Battle Ground.
They also did say when you asked them, Chair Young, that they did expect DSHS would, they didn't know of a reason that DSHS would not approve that move.
And then finally, this is just kind of an overview for the board as far as, what option would you like to go with? The 3 options are listed there. And then if the board adopts the idea of moving forward with a sale at fair market value, how you would like staff to move forward with the funds from that sale. So we can talk about that if that's the decision the board makes.
One last thing, and I do think we should offer Michelle the opportunity to speak as well. But just in terms of doing my best to answer the question that was asked in public comment about what is the public fund responsibility in terms of if after 5 years CMAR sold the building at fair market value, in terms of public fund stewardship, one of the contingencies of any sale of the building to CMAR would be the rehab work that is required in the building that CMAR is saying that they would do. And, as everyone is aware, including has been pointed out, as everyone has been pointed out by everyone, the rehab cost exceeds the cost of the appraised value of the building. And I do not see, besides the fact that we have asked HUD and gotten their approval to do this, if the board and the council chose to move in that direction, HUD doesn't see any conflict. I don't see any conflict either in terms of the usability of the funds. CMAR would be spending a lot of their own funds to get it to a place where they could realistically sell it.
Michelle, would you like to add anything about the process on for your department and what it has been?
Yeah, so a big thing I want to bring up is that we have been discussing this for well over a year now about what to do with this building. And every day that the county does continue putting off making decisions, that building's condition continues to worsen and deteriorate. And so, and that means the cost of update, upgrades, upkeep, maintenance on that building continues to grow. And so I just want to say that it will be nice to make a decision one way or the other, because this is deteriorating that building continues to deteriorate. And so we do, for our tenants, whether we keep it or we sell it, we do need to make sure to do something with the building. Rebecca did touch on a lot of points I wanted to make, but it is true we did not get the congressional spending, and we did not have time to submit for the next application for that. So we're not in the running for any congressional spending money at this point. So anything that does go in the building, if we were to keep the building or put any money into it, would take away from money that we could put into a different county building. With the, and as Councilor Young said, with the, sorry, I just lost my thought on that one. Basically, let me go back here a second. So if we were to put this out for fair market sale, we would be looking at appraisal costs about $2,000 to $4,000. And then the sale takes a lot of county resources to sell a county property. We have to get a number of departments involved with that. And we are looking at a cost of probably about $5,000 to $6,000 of staff time if we do go out to a public fair market sale on this building. And so that's just something to keep in mind, is we're looking probably at a cost of about $10,000 if we didn't do a direct sale to CMAR. And as Councilor Young said, this is what I was going to say, is that this was approved by HUD. It's a very rare approval to get HUD to say that we can do a direct sale to a tenant in a building. Typically, you do have to go out to a fair market sale. And so HUD did see that with this tenant and this location, that it made sense to do this with the building. So I agree that I don't think we're going to run into any conditions of that after that 5-year restriction that they could use the building as something else. There's nothing saying that they have to sell it. They can continue to operate at that site and use it for other services also. The big thing though is if we do keep the building for any reason, we are currently on a month-to-month because we have not done a full new lease with CMAR. So we would need to look at doing a new lease with them. But from internal services and the property management committee's purview, we're leery about getting into a new lease with this tenant unless we can guarantee that we can put some upgrades into this building, because the building is deteriorating. We don't want to be a bad landlord to them. And so we do, if we don't go the sales approach, either selling it to CMAR or selling it to fair market value, we do need to find some funding to put into this building, or we should continue at some point discontinue renting it to anyone. So those are just some things to bring up, but really Rebecca hit on a lot of the stuff I would have brought up. So any questions?
Any questions?
I think
Yeah, Victoria, go ahead. Thank you, Michelle.
Yes, thank you, Michelle. I just had one question. If we were to sell it at the county were to sell it at the fair market value, correct me if I'm remembering things wrong, but those funds would go back into the CDBG funds, correct?
That is correct, which could affect the timeliness that Rebecca's talked about with the how the community block grant program funds need to be spent. But yes, all the
Understood.
proceeds would go back into the block grant.
Understood. I just it was I got a little excited when I think about that because we see some applicants that were not able to receive funds this time around, and I'm just thinking that we could be supporting them if we were to sell it and those funds would go, we would get funds to help those applicants. That's why I wanted clarity to make sure that would be possible.
I have a question real quick. So similar to what Victoria was communicating, it would go back into CDBG, but is there any category that it specifically would need to be earmarked for?
No. No, once it goes back into the CDBG program, it could be used in any of the categories that we could fund with CDBG funds. I think that, and that's absolutely true. An unknown is if we didn't make, if we make timeliness this year and we don't make timeliness next year, I don't think the consequences of not making timeliness next year would be as severe as this year. This year would be fourth time in a row. We would likely go into required consultation, and the question that HUD would look at with that consultation is how much do they reduce our CDBG allocation, formula allocation for the year, and for how long? And we're not sure how that would work. We believe, my original understanding was that they would reduce the allocation in perpetuity. What we think right now, our understanding is that they would remove CDBG funding down to the 1.5 times of our annual allocation in the balance in that year. And future allocations would be based on the standard formula allocation, I think. And honestly, at this point in time, I don't know that anyone at HUD could give us an answer as to what would happen exactly. It is, having said that, it is possible that we don't meet timeliness next year. HUD could say, yes, this is the first instance that you didn't meet timeliness, but this would be the fifth time in the last 6 years that you did not meet timeliness. And they would ask us to do a go through the consultation process. So the reason I'm saying that is, though I do believe the consequences would be less severe, I cannot promise the board that there wouldn't be consequences if we don't meet timeliness in 2027. And those consequences could be a loss of CDBG funding. So I couldn't guarantee that any revenue we got from a sale would translate to more funding for future applications. I'm not saying that to sway one decision or another, it's just to make you aware of that's what we know, or, like our best, that's what we know right now.
Okay, thank you. So another question then is, could we, we obviously can't sell before May 2nd anyway. So it would be for 2027 that those funds would come in for. Could we piggyback off of the current process that we have? There are several contingencies on here, several applications, especially in asset and economic development. Could we when the funds come through, call like a special meeting if we don't have one already scheduled to assemble, look at the funding, take a look again at the applications that we received during this round, and allocate that funding basically as soon as we get it to one of these programs.
Yes, so our Urban County Policy Board application and funding guidelines actually dictate how we would deal with contingency projects. So we select them now, and then if we have additional funds by September 30th, then we would go ahead and put those funds into those contingency projects. If we receive those funds October 1st or later, then we would put it into the next request for application round. So they would be available for next year's rounds of applications. So it would depend on when we did the actual sale, when it moved through. That would be the first place we would go to on what our next process would be. We can, if the board would like, schedule a special meeting and discuss how to allocate those funds. Whatever we do will impact our action plan. We'll have to do a substantial amendment. So we'll just need to keep the processes in mind as far as making sure we complete all of the things that need to be done for HUD's satisfaction on the funds that we get, and then we reallocate them out. So we have options to move forward. As you can see on the screen, a couple of them would be doing a special targeted RFA. As is being suggested, we could put all this fund as contingency, and the board could now say what you would like to do with those funds. If it's before October 1st, say we're going to go ahead and fund the next several projects. So the board has some flexibility in what that would look like.
Okay. And then my next question would be for Michelle. The staff expenses, so the staff expenses are going to be outside of community services.
Mm-hmm.
Can those staff expenses be reimbursed by the fund?
So I can answer that question. CDBG cannot pay for an appraisal. It cannot pay for any of the sales, any of those things. So CDBG funds would not be able to reimburse the county for that process.
And then my next question would be, so that say we sell the building for 500,000, just picking a number, are we able to place an admin portion on that amount of funding?
Yes. So any program income, we can take 15%, which is CDBG administrative rate.
Okay, and could that be used to backfill staff time on the sale?
I don't believe so, because it would be activities that occurred before the funds became available.
Okay, so there will be some expense borne by the county that's not reimbursable, essentially, and that would come from the general fund, I'm assuming?
Real Property Services, which is under Public Works, helps with some the county sales of buildings, but the majority of it would be general fund.
Okay, all right, and then Victoria, I see your hand up, but I have Stephanie that hasn't said anything yet. So go ahead, Stephanie.
Thank you, Chair. I'm calling from Yakult, and I know we're just a little town, excuse me, a little town out here, but I want to speak on behalf of so many people in North County. It sounds to me like if this building is sold at fair market value, that feasibly there's no other option other than moving those clients, if you will, those patients, to Hazeldale or Vancouver. And I think there's a lot of people in Yakult, Woodland, Amboy, maybe La Center and Ridgefield even, that would use the Battleground facility, but wouldn't go down to Vancouver or Hazeldale just because of the difficulty. And so, you know, at first there was a gentleman who was, or a couple of gentlemen that spoke up saying that there's just no activity. And yet the report, the other report that you showed, said that there's 600 people that are helped in person at the facility there in Battleground, that's more than 27 people a day, or 27 families a day. Versus if you sold this building at fair market value, you might be able to help a couple of the other organizations through CDBG or home funding. It seems to me like you're helping a whole lot more people by selling the building to CMAR and requiring that they continue providing the services that they provide now. And that's about all I had to say.
Good comment. Thank you.
Chair, if I
Right.
could,
Go ahead.
I want to go back to a question that you were just asking about, and I just wanted to maybe frame it a different way, just to make extra sure. This is for staff. Are you saying that there's very limited or no options at all for cost recovery on this if we were to pursue option 2, sell it at fair market value?
That is correct.
Yeah.
That's my understanding also.
Victoria, go ahead.
Yeah, sorry. Thank you, Chair. My hand raising, actually, I forgot to lower it from the last time. But so you said the appraisal cost would be anywhere between 2,000 to 4,000, which that one we could go back to receive those the funds. It's just the staff time, correct? That we can't go back to get the funds
I
repaid.
don't believe even the appraisal that would have to come out of just a general fund or another pot of county resources. I don't believe we get that.
That's
What was
correct. 'Cause CDBG funds would not be able to pay for any of the costs, the appraisal or the cost staff time to sell the building.
I'm sorry, I guess I misunderstood. What was the 15% that you said that we could go back for then? Or we could go up to 15%?
So if the building were sold at fair market value, whatever proceeds were made, 15% of that would go into administrative funds.
To
But
be
that
used for
administrative
future
fund is
use of
for
the money.
CDBG administration, not
Oh, not for county.
correct.
Correct. Everything will
Okay.
go back to the CDBG program.
Okay. Okay.
And the issue is like by federal regulation, we couldn't use the CDBG funds for those appraisal and sale activities.
And then to just to reply to Stephanie, a little, I don't know how long she's been on the board to know, like, has she been here during all of our conversations? I do apologize because this is something that we have been going on over for a year. So I don't know how long she's been on this board to hear our conversations. And so I do apologize if what I'm speaking at this time is redundant. But just to save time, I guess I'll get that answer if I could, or just I'll keep going with her concerns about Battleground and her own citizens in Yakult and the North area. I wish that CMAR was here on the line today because I'm just a little confused because I've had side conversations with him. It's also, I think it's even been addressed on this in this committee that on one time, like he'll have what was his name? The gentleman, Mr. Rodriguez. Is that what was his last name? Ramirez. Thank you.
Ramirez.
Sorry, I'm thanking my brain for remembering. Nick Ramirez. That one time they said that they would lose that the North County would lose services, but then also at other times he said that, well, this isn't where I came to discuss these options on this board. So they could potentially, I mean, we've had conversations where he'd been willing to work with the city of Battleground to see if there's potentially some other areas in this neighborhood. So I'm confused and I wish they were here today to, you know, define or just kind of help us with that decision that we're going to be making today. Because it's just very concerning because on sometimes they're willing to look and then it seems like on another note, they're not. So, but in regards to how many people, one of the things to address, that sometimes you hear 600 people show up there and other times it's 900 people, but as a lot of people can contest to, especially people have come to this meeting outside and citizens who have come to speak, and I myself who live in Battleground, those and speaking with staff there as well, that those doors are closed a lot of the times, and I know that's for safety reasons. If they only have one person, one staff member at the building, you can't, they keep the doors locked for safety. And there's not a lot of activity. Most of their activity is done over the phone. And that's just to address what sorry, Stephanie, I don't see your last name to address you. Oh, Miss Fields, thank you. Sorry. And I know that Battleground has expressed that we would like to keep their services, but find a better location since the city of Battleground has been looking at a revitalization plan for Old Town, and to find something that would be better, maybe closer to a grocery store, which would make more sense since this property is so far away from the main line. Thank you for your time.
I would say I share your frustration that they're not here today. We did invite them. We did give them specific questions that we had hoped to have answered for this meeting. I think I do agree with Michelle, we need to make a decision today on this. I'm inclined at this point, just based on my memory of the conversations that we've had in the past, Stephanie, I recognize your thoughts on that, and I wondered that as well. Without them here to be able to speak to that, the messaging that I got was that they would be able to continue to service their clients even in a different location. So that is what I would go by at this point. Given that they're not here to respond to that, at this point, I think that there is a path forward that we could sell the building on the open market and look at the applications that we currently have and use that funding and assign it so that it's right away working, so we don't contribute to our issue of timeliness, because that is a real valid issue that we need to stay on top of. Those are my thoughts at this point. I just feel like if CMAR is able to continue servicing their constituents or their customers, that without the building, that we could use those funds to do even more good in the community. The only thing that would hold me back from that at this point is the risk of timeliness. But I think we can, if we're on top of this thing, we have a special meeting as soon as the building sells. We work with the existing applications that we have. If they're able to continue on, obviously the timing would change for them. And so that might be an issue. I don't know. I think that seems like a reasonable path forward. What do you guys feel?
I agree with you, Chair. I'm very excited to see the opportunity to help those applications that it looks like they're going to be hurting a little bit because of the shortage of funds that we have for them. So just to keep us moving forward, looks like you're looking for a motion at this time. And then if there's, because we're hitting close to 11 o'clock, I'm afraid you might have to make a motion to extend the meeting at this point. So I'll just, if you're looking for a motion, I would motion that we sell the property at fair market value.
Okay, Rebecca, before we move to a second on that, can I ask you, is there any other language that would need to be in this motion in order to accommodate the fact that we are going to look at the existing applications that we have in the future, or is that not something that needs to be done at this point?
We could do two motions, one that's specific to the selling, how we would be using the building, moving forward with the building, and then a second motion on how you would like to move forward with those funds.
Okay, so I take Victoria, let me just double check. Is your motion essentially that we recommend selling the building on the open market?
Yes, Chair.
Is there a second?
Second. Joe from Washougal.
Okay, great. It's been moved and seconded. Any discussion? Okay, all those in favor, say aye.
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 And any opposed? Okay, motion passes. All right, let's hit the second part of that. Does somebody want to take a stab at some language directing on how we deal with the proceeds of the sale of the building once it's complete?
So if it might be easier, we can just kind of lay out some really quick options.
Sure.
So our options are, as presented on the screen, we could do a focused RFA for the sale of those buildings, specifically to try to find another location in Battleground. The second option is we could do the funds depending on the timeline in the next request for application timeline. A third option would be staff could put up a recommendation based on the current scoring of the program year 2026 applications, like we've done today, like give you the best, how we can use those funds to do as many projects as possible. And we can present that at a future meeting, depending on when the building actually sold, which may end up being, let's just put it into the next round of RFA, depending on what that option is. So I would say those probably are three best options. If a board member would like to make a motion on one of those, or if they have an even better way we can move forward, staff are happy to oblige.
And I don't, in all the options Rebecca spoke about, I don't know that we need an immediate answer on those, correct? Because we already have our contingency applications from this round, and we don't know how much, how much will be available without having sold the building. We don't know how much would be available yet to do a targeted RFA of any kind, if that's what you chose to do. And depending on the timing of the sale, it might be a default best decision to roll it into the next round of applications.
I would like to add one thing. With the board opting to sell at fair market value, we will be rescinding the $200,000 offer to the county for that from the program year 2025 fund. So those will automatically go using the contingency method in the program year 2026.
Can I ask for clarification on that? We won't be rescinding it before the council decides, correct? Because this is a recommendation that goes to the
Correct.
council.
It needs to wait until, unless the board makes a motion today to rescind it, then I can do a whole process together. Otherwise, I'll do two separate processes. One for the new action plan and one for a substantial amendment to program year 2025. So
And it's 11 to 7.
And just a quick reminder for everybody, the 200,000 that we're talking about is money that was approved last year or the year before.
Correct.
For maintenance of this building, which has not been spent because it's been in limbo this entire time.
yes.
So, I mean, personally, I think that letting staff make recommendations from the applications that we currently have would be the ideal situation. So I'll make a motion. So I move that we recommend at this point rescinding the 200,000 that was previously approved by the board, and that we have staff issue us a recommendation when the sale proceeds when the sale's closed and the funds are available, have staff present us a recommendation based on the scoring that we received and the applications that we received in the scoring process for the board to choose from.
One clarifying question, with the rescission of the $200,000, is the board okay with me moving forward with funding through our contingency process now with the $200,000 only, and then recommendations for the sale amount at a future meeting?
I think that's appropriate. I mean, the recommendation given to the council and accepted included the contingency. So to me, this is not.
Okay.
Well, I don't know. What are the thoughts of the rest of you?
I agree with that.
Okay.
Yeah, I would agree with that too.
Yeah, that would be allowing you then to, and that helps with our timeliness. So.
Yes, thank you.
Yep. Okay. I made a motion. Is there a second to that?
Second for Air Battleground.
Okay, it's been moved and seconded. Are there any thoughts, last second discussions? Okay, hearing none. All those in favor say aye.
Aye.
Aye. And any opposed? Motion passes. Great. At this point, we are at 11:02. Do we continue on at this point, or do we need to?
If the board is willing, if we had 5 minutes, we could get through the last couple of things. Otherwise, I can just give you an update through an email.
Okay, can we hang on for 5 minutes? And anybody that would need to drop off can do that.
Correct. There's no more
Yeah.
action items.
Yeah.
Business items.
Okay,
yeah.
great. Go ahead.
Thank you. So quick program updates. One thing, when we originally put the request for application out, we were learning how the public service funds work under CDBG and had originally proposed that the program works like our asset and economic development programs and our tenant-based rental assistance programs, where they would operate on a January through December timeframe after we received our grant agreement from HUD. However, what we have learned is that it is really based on what amount the 15% cap is based on the amount of spending done within our program year of July through June. So we can't really split it between two program years. It makes it very, very complicated. So we will be reaching out to the public service agencies to get them up and running very quickly. And we will actually have those contracts start July 1 of this year and then go through June 30. And then in future RFAs, it will be updated to where that's known how that program will work. It will be a July through June program year to align with the federal program year. So we just wanted to give you guys an update on that, a change that needed to happen. And then we talked a lot about our timeliness update. We submitted our quarterly progress report to HUD in early February. We are still projecting to be on time by May 2nd, but it is going to be very close. I am literally scrambling for thousands of dollars to get spent by our different programs and projects. When we did the timeliness check on December 31st, it was 2.49. I think it went down to 2.48 when I most recently checked, and it needs to get down to under 1.5. So I still have quite a bit of ways to go. We are working with different agencies. I've checked with finance and the county's auditor's office, and they are going to allow us to do some immediate pay so I can accept application or invoices for reimbursement through April 23rd that have to be processed the next day and submitted for reimbursement and then paid the following week, then actually entered into the IDIS system, and that takes 2 days to process. So I'm taking it down to the wire to get as many dollars spent as possibly can to meet that timeliness requirement. And then some projects that were anticipated to have some or all of the cost build are experiencing delays, which is why I'm quite nervous at this time, but I am doing everything in my power to get as much stuff done as possible moving forward and getting those dollars spent. And then finally, we just want to let the board know that National Community Development Week is April 6th through 10th. We are going to be on the calendar to do a proclamation with County Council on March 17th. The council is not going to be in session the week of Community Development Week, so we are doing it earlier. If any of the small cities would like us to put together a draft proclamation for you to do at your own city, we would be overjoyed to have that happen, and we can put something together for you so you have something that you can present and do. Just reach out to us and let us know, and we'll put that together for you. And that is everything staff has.
Great. Thank you so much. Appreciate all the work that you do and trying so hard on all the finagling that you do to try to make sure everything gets done as quickly as possible. With that, unless there's something very pressing for good of the order, is there anything anybody has? We are running late. Okay. Well, thank you everybody for all of your work and time on this. And again, to all the applicants, and things are still somewhat in limbo for many of those applications. So we appreciate your patience with that, and we are adjourned. See you later.
Thank
Thank
you.
you.
Bye.
Thank you, UCPB.